Hi, welcome to the 3-minute What's That Tingling in My Leg video. I'm Dr. David Warwick, your local AC Olympia chiropractor and author of Back and Neck Pain Relief, short-term care for your back and neck pain and not one single visit more. You know, many times when you think of people with low back pain, you visualize a person kind of bent over and having their hand on their back in the sore spot. I could relate to that from even personal experience, but there's another aspect of back pain that's associated with tingling or shooting pain down the leg. When you experience this, a lot of the problems that we feel, we look at in a different way, and that's what a chiropractor is trained to do. And so just 1 minute, I want to get a model right here for you in demonstrating and looking at in the front, so you have a little understanding of the anatomy. In the front you have the vertebral body, in the back you have the transverse process and the spinuses back here. In between each vertebral body, the front of the bone here, are discs. Those things give us our heights, the height of that, and this bears most of the weight into this area. Between each of those areas or anatomy are what's called pedicles. Now genetically, some of us have smaller pedicles than others, and this is what can affect the actual hole where the nerve passes through. And so we look at what's called the foramen. When this area becomes compressed or pressure on that nerve, this is what we call foraminal spinal stenosis. And as we age, all these areas start to wear away. We call it osteoarthritis. So if you have any and degeneration of the disc, this is where the foramen and the nerves exit through there, can become pinched. And so someone with a shorter pedicles in there have a greater chance of feeling that pinching of the nerve, the numbness, the tingling, the pain going down the leg, those kind of things. Same thing with when we look at where the spinal cord travels, right in the back here between the spinous and the vertebral body. That cord runs from our brain down right in the center here. That's called central canal stenosis. And when you feel those kind of things, some of the causes can be the bulging disc, spurs or osteoarthritis, the spurring, even thickening of ligaments. That's the central canal stenosis. But the symptoms that you feel people often describe as having difficulty walking, tingling, a heavy type feeling, soreness, aching in both legs, those even using the words cramping. So but there's a couple other things associated with that spinal stenosis, and we call that neurogenic claudication. That's something we want to be aware of. We have to differentiate that from vascular, and that's where both of them can have a very similar type feeling, but the neurogenic can the vascular can have the lack of the blood flow. You know, when you're younger and you experience tingling in the leg, that is usually due to a facet or an SI joint that may be affecting the area. And a lot of times that area will have a bulging or herniated disc that can be putting pressure onto that nerve, creating that leg pain to go down the leg. So often, that tingling will be coming from a joint, and you'll often feel it on the inside of the leg, sometimes the outside of the leg, and it's described as a generalized aching type tingling down the whole leg into the foot. Sometimes it'll even stop at the knee. So chiropractors are able to manage these type of conditions, and we offer a non-invasive and effective form of non-surgery, non-drugs to help you with your low back or even tingling down your leg. I'm Dr. David Warwick of Warwick Chiropractic. Visit my website at drdavidwarwick.com or call our office at 360-951-4504. Thank you for watching, and look for our next video.